54% of the world's current population lives in urban areas, and that number is expected to rise to 66% by 2050. Never in the history of human civilization have so many people chosen to live in urban centers. With this rise in urbanization also comes a rise in unhealthy lifestyles. The World Health Organization estimates that 25% of adults worldwide are insufficiently engaging in physical activity. Sedentary lifestyles are causing increases in diabetes, cardiovascular diseases, and cancers, killing over 40 million people each year. In Canada, activity is estimated to cost $6.8 billion a year. Growing urban centers and rising physical inactivity may seem like two unrelated issues, but there's a solution that can help solve both at once. Active transportation. What is active transport? The Government of Canada defines active transport as any transportation that is human-powered. Active transport consists of walking and cycling, either on their own or as means to a bus or subway stop. These types of transportation encourage physical activity and are correlated to an individual's overall health. The WHO defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Let's start with the physical benefits of active transit. The WHO recommends a minimum of 150 minutes of physical activity per week, which equals roughly 30 minutes of activity 5 days a week. Integrating active transit into daily commuting is an easy and inexpensive way to meet this recommendation. When we look at mental health benefits, we see that active travel can reduce anxiety, depression, stress, and instill a greater sense of calmness and confidence. Studies consistently show that walking and cycling lead to higher levels of subjective well-being, whereas automobile congestion and long commutes have been associated with stress and lower subjective well-being. Finally, the social health benefits for individuals and communities include increased workplace productivity, better school performance, and better opportunities for socialization and establishing a cultural identity. Through encouraging physical activity, active transportation has the opportunity to foster positive relationships, culture, and work performance through improved social health. These benefits can be translated into reduced healthcare costs. A 2008 study estimated that adding an extra 8.3 minutes of walking per day in transit trips could reduce obesity-related medical costs in the U.S. by as much as $5,500 per person. Investing in active transportation planning, such as improved public transit systems, walkable street networks, and safe cycling paths, can significantly decrease healthcare costs. To recap, why active transport? It all comes down to health, economics, and quality of life. So what can I do as an individual? First, get informed on the health benefits of active transport. Second, talk to your local representative about improving active transport infrastructure and education. Third, leave the car at home and make active transit part of your daily routine. Shifting the culture away from cars and towards a more active lifestyle starts with you.